Hi guys, it's Todd again. I got my notes. Like I said in my last video, it's kind of hard to make a video because I'm trying to find a quiet place to make a video. So please forgive all the shadows and overcast because it's about the best place I can find to make a video. There's just too many people around my house, too much noise. Okay, and for everyone who has subscribed, thank you. I do appreciate it. Now, like I said on the title of this video, the title is absolutely correct. I'm 61 years old, and my health insurance costs $100 a month, okay? And I have no co-pays, and I have a $1,000 deductible. However, my monthly living expenses is only about $2,000 a month, and this covers food, transportation, and all of my activities. I'll talk more about my living expenses and why it's so low more towards the end of this video. All right? However, my health insurance is international health insurance. The biggest issue with international health insurance is it doesn't work here within the United States. It only works in other countries. Plus, it's only for emergency hospitalization. But overseas, all you really need is emergency hospitalization. And I will explain more within this video why that is the case. Now, I'm also receiving Medicare, but I was told that Medicare does not work internationally, but later discovered after I got a new agent that this is not true, this is not correct. Medicare does work overseas. And this is whether it's Medicare Supplement, Medicare Advantage, or regular Medicare will work internationally. However, each one works internationally in a different kind of way. In this video, I'm talking more about Medicare Advantage, because that's the one I have. And I'm also going to talk more about international health insurance from a private provider. Because I believe Medicare did not work internationally, before I went to Thailand in 2004, I shopped around for international health insurance. In 2004, I had a heart attack while I was in Thailand and had to go to the hospital, to the emergency room. I was in the hospital for 4 days, then I got discharged. Then 5 days later, I went back to receive follow-up care. The total cost for the follow-up visit with the doctor, with the ultrasound on my chest, and a week worth of medication only cost me $300. I had to pay everything out of pocket. I had to pay the cost of the emergency room, the 4 days in the hospital, the doctor visit, the follow-up care, the ultrasound, the x-rays, all of that came out of my pocket. This was because after I checked into the hospital, after I checked into the emergency room, I found out that my international health insurance didn't work. It would not cover anything that was related to a pre-existing condition. And if you have diabetes or high blood pressure, most of those conditions are related to a whole bunch of other conditions. And because of that, I had a heart attack and it wasn't covered. After the follow-up visit in Thailand, the next day I hopped on a plane and I flew back to America. Once in America, a couple days later, I had some more complications. I checked into a hospital here in America, but discovered that the treatment I had in Thailand was much better than treatment I received here in America. As you can see, I'm a black American, and I think this is why the treatment I received in America was not as good as the medical treatment I got in Thailand. Thailand or Asia, I did not experience any racism or prejudice. Now, when you purchase international health insurance, you must be careful. I had originally paid $200 a month for international health insurance from a major international health insurance provider. When I got to Thailand, when I needed to use it, is when I found out it didn't work. I had what is called IMG, or International Medical Group, out of England. Now, IMG has offices here in the United States. And maybe if I would have purchased international health insurance from the United States office, I may have been covered, but I didn't know. So I had to pay everything out of pocket, which drained my savings. However, Medicare Advantage plan, when I got back to the United States, did reimburse me for all my medical costs that I attained while I was in Thailand. After that experience, and knowing that I'm going back in 2026, I now knew what questions to ask when looking for international health insurance. I now know what questions to ask when looking for international health insurance. My biggest concern is, do I have to pay everything up front? Do I have to pay everything out of my pocket and then get reimbursed? Or will the insurance itself pay the hospital directly without me having to go into my savings and then get reimbursed later. Now I did a lot more research and I discovered that the international health insurance that would pay the hospital directly, one is called United Healthcare Global, the other one is called Faye, and there are many others that offer the same coverage at the same price. I told both of these companies that I'm 61 years old, have pre-existing health conditions, and they both told me that my pre-existing health conditions will be covered if there's an emergency situation. They both said that it will cost me only $600 a month, $600 for 6 months, which means that it's only going to cost me $100 per month. They also said that they would pay the hospital directly without me having to pay the hospital up front or any money coming out of my pocket, or having to go through the reimbursement procedures. However, in 2026, I discovered that because I'm receiving a Medicare Advantage plan, I do not need international health insurance. Some Medicare Advantage plans will pay the overseas hospital directly for emergency procedures. Thus, I will not have to come out with any money out of my pocket. We'll have to go through their reimbursement procedures. The two that will pay the hospital directly that I know of, one is Aetna and the other one is United Healthcare. Now, if I had known this in Thailand, I probably could have just gave the hospital in Thailand my Medicare card and everything would have been taken care of. And I would not have to have gone through the reimbursement procedures. I was told for years that Medicare would not cover medical costs overseas, but now I know that Medicare will cover all medical costs if it is an emergency treatment. And healthcare overseas is cheap. And this includes the cost of the medication, the medical treatment, doctor visits, and even dental visits. So all you really need is emergency hospitalization. A doctor visit overseas is about $30 per visit, which is pretty much the same as we pay here in America for our copay. Medications overseas are very cheap. All you have to do is just go to the mall, ask them or tell them what medications you need and how many pills, and they give it to you right then and there. You do not have to go to a doctor first. You do not have to get a prescription first. Just go up to the mall, go to the pharmacy or the drugstore, and it'll give you exactly what you need. No questions asked. And in Vietnam, you go to the dentist there. Some of those dentists offer free x-rays and free consultations. And most of these doctors in Asia is trained in Australia, United States, or even in Europe. So they have the same medical training as they do here with the United States. Now, I was in Asia for about 6 months. I went to Vietnam first, then Thailand, then the Philippines. And went to every major city within Thailand. And a lot of major areas within the Philippines. And while I was in Thailand, every day I ran into a Black American. There's a lot of people from the ages of 20 to 80 years old who have moved to Thailand, the Philippines, or Vietnam because it's very affordable. And these are people who are from the 20s, like I said, to the 80s, people who have families, people who have kids, people who come from very little money. I mean, the biggest cost is going to be your plane ticket. And it's one YouTube video I saw of a couple who has a little baby girl who's like about 4 or 5. They took the time and saved up for about 2 years. All they did was work and save and paid off bills. And after 2 years, they took off. And they've been traveling through Asia for over a year now. And they said they're much better off. Now, in Asia, you can get a 1-bedroom apartment in a nice high-rise building with a rooftop pool, a gym, and all of that stuff for $450 a month. You can also get a 1-bedroom apartment on the beach for $450 a month. In Vietnam, you can get a 2-bedroom, 2-bathroom, 2-story townhouse about 4 blocks from the beach for $600 a month. Now, when I was in Asia, my biggest expense was food. I spent $900 a month on food because I never cooked. And I ate mostly at Western-style restaurants. But the problem with this method is that every morning you have to get up, get dressed, and go out and find food. So I would just go to McDonald's or Burger King to get breakfast. However, Asia has something called Grab, which is like Uber Eats here in the United States. And the delivery fees for Grab is like $1 to $2, and that's with tip. So I ordered a lot of food through Grab. Now, to take a Grab ride, or take a 30-minute Grab ride, is only around $10 with tip. A motorcycle Grab ride is only about $1 to $2, and that's with tip. So around $2,000 a month, you can live very comfortably in Thailand, the Philippines, Asia, Vietnam, Bali, or Malaysia, or Indonesia. That's all you really need. You probably think, well, can you give me any advice about how I can afford this? Well, if you only need about $2,000 a month, which means you only need a job working 35 hours a week, making about $15 an hour, is going to give you that $2,000 a month. And there's a lot of things you can do over the internet, like customer service rep, administrative assistants, and other jobs that really don't require a lot of education, a lot of skill. And the way it works is you get a job here in the United States, and then you move overseas, and you can keep collecting your monthly or your weekly paycheck here in the United States, deposit directly into your bank account here with the United States. Because while you're overseas, as long as you have your debit card, you can always just go to an ATM and just take out the money, as if you're living right here within the United States. Well, one more thing about the apartments and the townhomes in the United States and within Asia. When you move into these townhomes or apartments, they're fully furnished, everything is there, even the silverware and the plates. All you really need to do is just bring your suitcase. They do not ask for a credit check. All they ask for is the first month's rent and a deposit. And you can move right in almost the same day. It's that easy, it's just that simple. And that's why there's a lot of Americans, a lot of Europeans, a lot of Canadians, and Australians have moved to Asia because it's so affordable. And everyone has their own preference. Some people like Thailand, some people like the Philippines. Myself, I like Vietnam, but I'm gonna try Bali. I was told that Bali is supposed to be great. Okay, that's about it. I'm done. I hope this video helps a little bit. Don't forget to like, subscribe, and all that stuff. All right, adios.